Good morning. Good morning. Welcome to Mending Threads. This is your safe place and your stronghold for whole body wellness. We welcome you to this transformation series, Mind, Body, and Spirit. And we are prepared for you today, along with my co host, Dr. Samuel Massey, pastor of Real Life Christian Church. We have a guest that is going to bring recognition and understanding to another aspect of whole body wellness. So I would like to welcome my co host, uh, Reverend Dr. Samuel Massey. Good morning, Dr. Massey. How are you?
I'm fine, and you? Good morning.
Good morning. Good morning. I want to say that it was a pleasure that we graduated in terms of whole body wellness. Um, the first program out of the mental health program that partnered with Real Life Christian Church to do that. And I just wanted to say thank you for all the work that you do before we even get started.
Well, you're welcome, welcome, welcome.
Yeah. So if you want to tell them just a brief about yourself a little bit, because we have some new listeners on. Did I lose you? Did I lose you, Pastor Massey? Well, let's hope that we can get him back in the show. And also we will have with us Dr. Gorell, Dr. Dominica Gorell, who is a pharmacist. And if I could say that she is a pharmacist that looks at the whole aspect of the human being. So if we can get back both Pastor Massey and Dr. Gorell. Thank you. Thank you. So I know we lost Pastor Massey, but Dr. Gorell, can you, when I looked at your bio, I want to, if you give me permission to read, to say something about you. I do want to tell our audience that I'm so pleased to have a young lady who, I'm going to be biased, who graduated from a school that I know not, I can't say up and coming because it is historically based, and I mean many professionals have graduated from there. And not only do you graduate, but you get a sense of who you are in the community. And that's what I appreciate about it. And you'll hear more about that. Dr. And I might miss her name, but it's Dr. Demonica Gorell, um, who received her Doctor of Pharmacy degree from Texas Southern University in 2008, the school. She is the owner of the Apothecary Pharmacy and Medical Supply. Now that's interesting. She has over 10 years of pharmacy practice experience, ranging from retail, compounding, and hospital pharmacy. Ms. Gorell was instrumental in launching a specialty pharmacy service in neurology, pulmonary hypertension, and allergy and immunology clinics in Texas Children's Hospital. And that is outstanding. And it's very knowledgeable in pediatric pharmacology. During the height of the COVID-19 pandemic, Ms. Gorell collaborated with the Harris County Health System house call program and provided life-saving vaccines to patients that were homebound and with limited mobility. In her leisure, she is a whole person. She enjoys reading and spending time with her two sons. I want to welcome Ms. Gorell to our Mending Threads show this morning, and I know that she's going to bring clarity to what prevention and intervention means. So, Ms. Gorell, can you just get people, I've told them about you, but can you just tell me a little bit about how you center with pharmacology? How do you navigate that differently than anyone else? And what is this about? Mhm.
Well, every person is different, and when you talk about medicine, you talk about pharmacology, you have to take a holistic approach to it. It's not a one size fit all situation. And so I think that with each patient that I encounter, I deal with them on a personal basis, trying to understand what their needs are and working with different, providers to create a more holistic approach to their treatment.
So do you do when the so in other words you provide, how do you do this to determine that you're providing something to this person? Is there a different way to handle situations so that you know?
Sure, like you have, a great portion of our patient population here are geriatric patients. Some of them have, limited mobility. They can't leave the house. Some patients have, multiple chronic illnesses. Perhaps they have family members that are not well equipped to manage their medications. They may be in and out of the hospital because they don't have access to, medications. And so when we get referrals, a lot of times we'll get referrals from, providers that say, hey, we have this patient that's on, multiple medications and they need assistance with organizing their meds. The family needs assistance with understanding, how to properly take care of them from a pharmacy standpoint. And so we try to kind of figure out what individual families need and provide that service, whether it's organizing their meds for them, whether it's going into the home and teaching them how to use their diabetic supplies, because that will, cause a lot of our patients to go in and out of the hospital if they don't know how to properly use their insulin, if they don't have the proper, testing strips and all of that kind of stuff. And then we also deal with patients that have, a fixed income. And so that's another aspect that, financially, if they can't afford their medications, we create programs to kind of help them so that they don't miss any doses because they can't afford it. And so we try to look at, is there financial issues going on? Is there, a lack of health literacy? So we try to educate them. Is there some type of, transportation issues and we need to deliver medications to them? Are they taking medications that are simply not working? They've been taking it for a long time and it's just not doing what it's supposed to do. And so that's when we go back to the providers and say, hey, let's try this instead. And so each patient is different, and we have to ask a series of questions to kind of understand what the needs are.
Mm-hmm. So then when you actually began to do that, do you provide like assessments for them?
Yes.
Okay.
So
And
there's
they.
a program called Medication Therapy Management. And
Mhm.
so it's a tool that we can use to really identify if there's any gaps in therapy, if there's any uh, issues that the patient may or may not be having. And so we do assessments, especially on our patients that are on chronic medications, and maybe they're taking, more than five medications and they get confused. And so we do these assessments with them. Mhm.
So I work with quite a few people like the veterans and others, and what I'm finding out is that they don't even know, they know that they're having reactions to their medication, but they're not knowing who to talk with, or when they talk with their doctors, the doctor's into how did this medication I prescribed you. But sometimes I find that the doctors don't even know that they're taking other medications that maybe another physician has prescribed.
Yes.
So you would be one of the people that a practitioner, when they know that their patient is taking medication, can they just call you up, or how do they? So how would you suggest a person make sure that they are not that their medications are not interacting in a negative manner?
So typically what we do here is when we do the assessment, we also
Mhm.
provide the patients a list of all of the medications that they're taking. And so whether it's over the counter medications, vitamins, and medications from different providers, because perhaps they have their primary care provider, but they also may be seeing a specialist for, psychiatry. They may be seeing a specialist for an endocrine doctor for, diabetes, or what have you. And so we give them a full list of everything that they're taking. And so no matter where they go, they can take it to their providers and they can show them what they're taking. And so we see that a lot, like sometimes, especially if they switch over due to insurance and stuff like that, we may start to see what we call a duplication of therapy. And so we'll contact the doctor and say, the patient is already on this type of medication, which is similar. And so that's why it's very important that patients stay at one pharmacy, because when you go to multiple different pharmacies, it's kind of hard to know, what you're taking.
Oh, that is, we're doing a newsletter, an e-newsletter. I would really love for you to put some tips in there.
Sure.
That is one right there.
Hmm.
Just a straight out a tip of not to, and most people do have more than one phone. I do know many people.
Hmm.
So that's a good tip to even how, and then even how to talk to the pharmacist.
Hmm.
So how do you invite people to talk with you?
So typically, I will just ask leading questions. Sometimes people are not as comfortable with, talking to the pharmacist about everything. And so you kind of have to ask those leading questions like, what medications are you taking? Are you, seeing different providers? So we ask, a series of questions just to kind of get a full picture, with our patients, and kind of engage them. And then once they start to feel a part of the family, then they become more open to you. And so I have patients right now that anytime anything changes, I'm the first person that they call. And so it's about building a relationship and a rapport with them so that they
Mhm.
feel comfortable talking to you about anything that changes as it relates to their health.
Yes. Oh, that's so special. So, Pastor Massey, um, how can this person, how can Dr. Garrell work with mental health coaches and the program that you have there? We can't hear you. Uh-oh. So we check your voice. Check your voice on your computer, and then we'll go with it. We'll come back in a minute. Check your voice sound. Okay, then. So one of the things that I do want to look at is that many of our persons um, tend to have substance abuse
Hmm.
and other issues, and maybe take many other mental health medications. So how do you talk with them, or can you assess or determine anything about them, or have them make recommendations if they are substance abusing?
So we try to look at trends. So a lot of times with patients that may have substance abuse issues, say with pain medicine, we see, quite a few of that as well. Um, or even sometimes psychiatric medications, what we tend to try to do is look at if they're trying to fill medications too early. That's an indication that perhaps they are taking more than what they should be taking. And so we look at like trends in their, therapy, and kind of make decisions based on that. If we see that they're, you know, taking medications too frequently, or they're running out before they should, then that's when we kind of reach out to the provider, and we also try to come up with a plan for these patients.
Hmm. Oh, that's great. So then you have a way of kind of paying attention to.
Yes.
Uh,
Especially when it
mhm.
comes to controlled substance, the state of Texas has a database where you can go in and you can see a patient's trends, like different doctors that they've been to, and you can also see what medications that they are taking and they could potentially be abusing. Now, you
Mhm.
don't want to stereotype these patients, and so I think that you also have to be careful about how you speak to them and how you approach them, because perhaps their therapy needs to be optimized. Maybe something needs to be changed. And so you don't just look at that one thing and make a clinical decision. You try to look at everything that's going on with the patient. And so that's why it's very important that that we reach out to the providers and that we take more of a holistic approach.
Yes, and it's awesome that you reach out to the provider, because You're providing such incredible services, you have no idea. And so then do you also provide like education
Yes.
training to, oh, you do? Okay
Yes,
then.
we do.
Mm-hmm.
Obviously, if the patient is open to it, because you have to be open to it. And so, if they're open to, receiving, counseling or additional, information, then we're here to provide that service.
Mm-hmm. Mm-hmm. Okay then. So one of the things that I was looking at is I saw, especially during the pandemic, that you had in terms of trauma. I
Mhm.
wanted to see what your thoughts are in terms of, I don't know if Dr. Massey, are you back? Are you back? No, he's not back. He's still okay then. So I wanted to understand how your trauma, your perspective on trauma and spiritual self. Now I know you can't deal with that directly,
Mhm.
in a direct manner with your patients.
Mhm.
Okay, but I want to know, how do you integrate the spiritual self with your practice?
One of the things that I have learned about trauma is that trauma is, you can't rush it. You can't rush the healing process of trauma. And so we all may have experienced trauma in some way, form, or fashion, but there is, in order to really deal with the trauma, there's a healing process that has to take place, and you can't rush that.
Mhm.
And it's not everybody's healing process looks different. And so, even like with the pandemic, with, people losing their jobs, or just fear in general, or just being isolated and dealing with that trauma, it looks different for everybody. And so, in
Mhm.
the same way that when we go through some type of surgery or procedure,
Mhm.
the doctor will tell you, okay, this is the healing process, because your body has experienced trauma related to the surgery. And so now there's a process. And sometimes along that process, whether it's 6 months, whether it's a year, whether it's ongoing, you have to see, your therapist. You have to go through different sessions in order to work through that trauma. And so I think that when I'm dealing with a patient that may have experienced trauma, I try to look at it from that aspect, that it's a process. And when they, first come to you with a problem, they may be aggressive, they may be angry, they may be frustrated, but that's also a part of the process.
Mhm.
And I think that,
Mhm.
you know, um, looking at it from that perspective, and as a professional, not internalizing anything, because you understand that there's a process being taken, that's taking place. I think it's really important.
Mhm. So then you're active with the person and their family, like even for the comorbidity of depression
Hmm.
and their medication. So how do you know, how do you discern or determine um depression if the person comes for medication? How do you determine the anxiety, whether it's related to the medication when you're there?
Um, I think we, for some of my, I'm trying to think of an example. Um, I'll just give an example. I had a particular um, patient who was bedbound. Patient had cerebral palsy, and the mom was. I could tell she was a bit anxious when we first started taking care of her child.
Mhm.
She wasn't very inviting, uh, and a little bit frustrated because of some of the previous, experiences that she's had with pharmacists and people just not being patient with her. And so, um, understanding that, I tried to put myself in her shoes and to understand that the places she's coming from and what her concerns are. And I think the first thing is validating those concerns.
Yes.
Not taking it
Mhm.
personal, like, no, I completely understand you perhaps may have distrust in the system, and it's valid. And I think,
Right.
understanding
Mhm.
that, going into it, understanding um, what what their issues have been, and really being empathetic, and not taking it personal. Like I know, although she may be upset, it's not a personal attack. It's based on her experience. It's based on her trauma, and so understanding that we were able to work with her, and she's eventually became one of our best, customers. We talk frequently, but it was a process. It was a process in gaining her trust. And so I think that in gaining the trust of your patients and the customers that you encounter, it's also understanding where they come from. Their experiences within the healthcare system, and validating that, and working to try to turn the tide a little bit and show them that although you've had this experience, we're going to try to provide you with a different experience.
Yes. Oh, that is so good because now you're talking to them and dialoguing with them
Exactly.
and letting them know that they're not by themselves. And then you're explaining to them what to expect, which decreases anxiety about what's getting, what to happen, the uncertainty.
Exactly.
Really good. So one of the things that I wanted to get into was more of is that there's a separate thing of compounding,
Hmm.
okay, versus medication from the shelf or medication that they send in. And I wonder if you could just talk about that a little bit because that's so important to balancing and whole body wellness. Can you just talk about the
Sure.
process and what that means? Yes.
Yes. So compounding is basically, formulating a product or a medication that's not commercially available. So, like you say, you can't get it off the shelf. It's like one medication that everyone is familiar with is Tylenol. And so Tylenol comes in standard doses. And so, say for instance, you have a patient who can't swallow tablets, or they may need a medication that's typically available in a tablet, but they need it in a cream form because they're unable to swallow. Maybe they're a hospice patient. Maybe it's a pediatric patient that the parents are having a difficult time with administering the medication. And so with compounding, what we're able to do is take different medications that come in a standard form and create a different formulation that will work for the patient, or even
Mhm.
a different dosage. So, say for instance, if the medication comes in a 250 milligram, and based on that patient need, they only need 50 milligrams. And so we're able to compound it in that form.
Oh, that is awesome. My first, I guess I started trusting it because that's what real pharmacy was really about in the first place.
Yes.
But I remember when I was going through changes with my hormone system and everything, I remember the doctor says that I can't give you any standard dosage. This is what we're going to have to do. You're going to have to go and have your dosage compounded.
Mhm.
And that was my first, and I was able to watch the pharmacist prepare it for me.
Mhm.
Okay, with the little thing, the little pedestals,
Right. The mortar and pestle.
water and pestle. She
Uh-huh.
was back there doing whatever. And actually, I tell you one thing, it gave me more confidence at the time
Mhm.
in medication because she was weighing it out carefully. And
Mhm.
it made me think that this is going to be just special for me,
Yes.
my health, you see,
Mhm.
my weight, my medical history.
Yes.
Mhm. And then she asked me not only all of the things that had happened to me, but what was most interesting, she asked me how each one of the medications or whatever I was taking or the food that I ate, she asked me about all of that. Now,
Mhm.
do you get into their nutrition?
Yes, it's very important because
Mhm.
some medications will interact with certain foods. And so it's important to get a complete, drug food allergy on a patient. Say, for instance, some medications, if you eat grapefruit with it, it'll affect how well it's absorbed. And so knowing what their diet consists of is very important because it can affect the way the medication works.
Mhm. Now, do you work with a particular laboratory that say if the person that if they have a nutrition I'm all check in with Pastor Massey to see if he's speaking right now. Can you get through, Pastor Massey? No. Okay.
Oh.
So I know, Pastor Mass is such a man for detail till I already know he's over there like really going through. But let's not keep going with your techie stuff. Okay, we'll check in a minute. But what I'm really trying to look at, and I'm talking about different things, but see what I'm really trying to get to is the nutrition that's in the cell,
Mhm.
that when the lab results come in, I don't know if you partner with the lab to say, I need you to get your lab results so that I could see how these medications are affecting you or what your blood. Do you do that? Do you?
Typically, the provider will do that.
Okay then.
So, say for instance, for medication like warfarin.
Mm-hmm.
Warfarin is a medication that's used to prevent blood clots. And so typically patients have to go and get what they call lab tests to check their INR to make
Mm-hmm.
sure, and they will adjust the dose based on that. And so, or a medication, say like clozapine, that if it's, which is for like bipolar depression,
Mm-hmm.
and that requires lab tests. Now, for some medications, the doctors will fax us over the labs so that we can see and we can document it. And
Mm-hmm.
so, typically, whenever the patient, especially if it's something that's going to really affect, the blood levels, um, they will monitor their labs more frequently, and then we'll be updated. Say, for instance, if there's a dose change or if they're going to discontinue the medication altogether.
Mm-hmm. And that's also the same for like urine test and things like that, so you could actually see how
Yes,
things are
any
processing.
fluctuations and things of that sort. So yeah, the
Mm-hmm.
provider will uh, usually get those results in office, and then we'll be notified. Hmm.
Okay. Oh, this is excellent. This is so special. So listen, the other thing is when you visit the home, are there other indicators or other things that you make note of?
So sometimes we'll go into some homes and we see that there there are a lot of issues at place that may affect how well the patient may do on taking their medications, whether it's lack of family support.
Mm-hmm.
So if we have elderly patients in the home and they have no one there to take care of them, then that can really affect how well they're able to manage their own medications. Um, if they are just really unorganized, and they don't have, I actually, it was one patient that I visited, and I saw Coca-Cola everywhere. Like it was just like sodas, and so you can look at, you can see things that as far as like diet, what they're eating, and how that may or may not,
Mm-hmm.
you know, attribute to their overall wellness.
Mm-hmm.
So these are things that you have to be very, very careful about addressing because you don't want to offend anyone.
Yeah.
But it is something that you can notice and you can see. And so if their diet is, if they have a poor diet, and their insulin is not working, then it's not that the insulin isn't working. We're not really taking care of our diet as
Yes.
we should. So
That's right. And then you then say the insulin could be more effective
yes.
if you could cut back on some of the drinks, or you say, do you give them information to show the things that would affect the insulin then?
Yes. So we try to provide, especially if we notice um, there's constant changes in doses, then we may start to ask some of these questions. And the doctors also do that too. The providers do that as well. The difference though with pharmacy and like maybe their primary care provider, is typically a patient will see a pharmacist every month or every 3 months. They may only see their provider once a year. And so we have more of an opportunity to kind of catch things as we see it. So if a patient is running out of, their insulin more than they should, we can identify, well, how much are you using? Are you using more? And if you're using more, why? What is the case? And so these are things that we can kind of bring to the provider. And so if they want to schedule them in for an earlier visit and kind of figure out what's going on, maybe run some blood tests, things of that sort. And now with technology, they have ways where you can actually document your lab results on your own. And so, as technology continues to advance, it's going to actually help providers, pharmacists, and even patients, really from from your own home, be able to help manage your medication and your health.
Can you explain that? How does that work?
So
Or
there's some
mhm.
systems. So every time a patient may take their blood sugar, and they also have continuous glucose monitors now, where you don't even have to take your own blood sugar. So the system continuously checks for any fluctuations, and it can be documented into a system that goes directly to your provider.
Now, is this the thing that you? Is it a needle that is something that you attach to your body or tape on your
Yes.
body?
Yes.
Okay.
So this particular one, it looks like a little patch that you can put on. And they have all these type of apps and devices, and you can send that data, or if you allow your doctor to have access to it, they can see that data in real time and know exactly what's going
Oh
on.
my.
Great. Hmm.
Now, I'm interested in this because of mental health,
Hmm.
needing to know when the blood pressure changes, when the blood sugar rises, it affects mental health. So I'm trying to see if mental health practitioners can also get that with their patients too, or does it have to be that I'll have to follow up with you on that. I'll
Yeah,
find
and I think that if the patient allows you to have access to that information,
Yes.
then you can definitely use that to make
Mhm.
a diagnosis or to kind of figure out what's going on.
Yes, I was able to contact biotech, and
Hmm.
I found out now that we can get, and it will from their phone. It costs a little bit. It costs a few $100s,
Yeah.
but those patients who can get it through their insurance, we're checking if their doctor. We now can monitor their anxiety level without them going into the office,
Hmm.
and their temperature, perspiration, and all of that.
Oh,
Uh,
nice.
so I thought if I had that too, then now I can see what's really going on with the system without having like biofeedback in the office, you see.
Right.
Trying
Right.
to stay out
Yes.
of the office to the best of my
You
ability.
have more objective data to work with.
Yes.
Yes.
That and to help the person, you see.
Yes.
Yes,
Absolutely.
yes.
Hmm.
Hmm.
That's really important because sometimes, our patients don't always tell us everything. So
Hmm.
having that objective data really, helps us to make clinical decisions. So that's.
Yes, I love that. I love it. And I'm just loving so there's another area that I wanted our audience to hear. I wanted you to share as much as you can or feel comfortable with today, um, about allergies, hypertension, the immune system. And I really wanted to take a little bit at a time is to explain because people think that it's hocus pocus or I'll just talk to the doctor or I'll just do this, but not understanding their responsibility or how it relates to neurology,
Mhm,
how what you do relates to the medication in neurology
mhm.
or hypertension. And I wanted you to just talk a little bit about um, how they could help themselves, the audience, persons listening, or how that relates to hypertension. Let's just take that portion 1st. Mm-hmm.
So I think first we have to understand that everything is interconnected. Our bodies are interconnected. Whatever you do to the heart can affect the lungs. Whatever you
Yes.
do to the lungs or the heart can affect the kidney. So it doesn't work independent of each other. It's an interdependent. And in the same way, uh, our spiritual wellness, our mental wellness, and our physical wellness is all interconnected. You can go to the doctor for blood pressure, but if you have a mental illness that's not allowing you to be compliant with your therapy, then it's not going to work. And so taking care of that is as as probably more important because I feel like your mental health is what directs everything else. you know
Mm-hmm.
so if I'm not mentally well, then I can't take care of my medications or take my medications like I should. If I'm not mentally well, then I may not be as diligent with having a good diet or maintaining a good diet. If I'm not spiritually well, then that can also affect my mental well being. And so I think that that's where we talk about a holistic approach, where
Yes.
you have to be spiritually well, whether it's whatever that looks like for you, whether it's meditation, prayer, yoga, whatever it is to create a good spiritual space for you. And then
Hmm.
that also affects you mentally, because when you feel good spiritually, I believe this is my own personal belief. I believe that we're spiritual beings. And when I feel good spiritually, then I function better mentally. That helps my mental well being. And
Hmm.
in essence, it helps my physical well being. And so all of these things are interconnected. And I think that
Hmm.
understanding that is you know, extremely important.
So we did a show, and we were trying to. I'm trying to get an artist to help me too, but we did a show so that people could understand in the real time. For example, if something happens, a situation, and you've already had all these difficulties, how the brain lights up differently, and how the cortex, the certain part of your brain,
Mhm,
is functioning with all the worries and etc., and how that moves to another part of the brain the longer you hold it. Even when the situation happens, the manner in which we interpret the situation
mhm.
affects the amygdala or another part of the brain.
Yes.
And that we're in process, as you spoke earlier, is going on with us at the same time, and that a manner in which we can stop it, slow it down, redirect it while we are on our medications or
Mhm,
changing our food, is to rethink. And
mhm,
then you mentioned the yoga
mhm.
and the whatever, is to really learn ways of being in the moment,
Yes.
prayerfulness, meditation, and all of that decreases the blood pressure. We've been studying that, and how they could actually. And so we're going to do a show coming up on a Saturday. I would love for you to come and
Sure.
help them through that on like the second Saturday and the third Saturday. The doctor comes on the third Saturday, and it's called Saturday Wellness Clinic.
Mhm,
And we teach them. You'd be awesome on the second Saturday too. You'd be awesome. Teach them things that they need to know,
mhm.
and then they practice it.
Yes.
So we practiced that, and they couldn't believe. We had them to put their blood pressure unit on,
Mhm,
and we did meditation, prayer, and we had them to say something to themselves that would help, and their blood pressure just plummeted.
mhm,
They had no idea that they could be that much in charge.
mhm. And
And
I like what you said about being in the moment, because that is so important. A few years ago, this word just was ringing in my head. I believe it was God, and it was intention. Being intentional about what you're doing. Every single thing, be intentional. And I think that when we move in the spirit of intentionality, like being intentional about what we're doing, that it helps us overall, health
Mhm.
wise,
Mhm.
physically, mentally, you're in the moment, you're present, and you're intentional. So that's important.
Mhm. Mhm. Very good. So then, so I have quite a few persons who have allergies. Now I know you just not all these doctors all in one person. Okay. But what do you see from the pharmacy side in terms of people's practice that brings on allergies, keeps it sustained, treating it? What do you see?
Are you speaking of like allergic reactions or
Allergic reactions,
allergies?
and yes, allergic reactions, what you see as a pharmacist. When people come in and they ask and they say, I have this medication that I'm supposed to get for my allergies, and from their lifestyle, or from their what their symptoms they report, or what's going on with that. Mhm.
So there's so for like allergic reactions or
Yes.
allergies to different medications,
Yes.
um the first question I always ask is, what type of symptoms are you having, because what a true allergy is different from what people may think it is. So if they may have, some nausea when they take a medication, which is a common side effect of most medications, but it's not an allergic reaction to it. So I try to figure out what the true allergy is. If it's like an anaphylactic reaction where they have difficulty breathing, that could just be genetic. They just, or their body is just not, is just rejecting that particular medication altogether. And so I think understanding what, if it's a true allergy or not. And that is something that really has to do with just how the body responds to what they're taking. Um, if it's like seasonal allergies, if they're going to their allergies, like, itchy eyes, watery eyes, um, things of that sort, sometimes that is also just, genetic. Perhaps their family has a history of, allergies or seasonal allergies. Sometimes it's, deficiency, vitamin deficiency. Sometimes it can be caused by stress. I know for me, sometimes when I'm stressed or overwhelmed, I tend to get a little bit sicker. But that also could also be because maybe I'm not taking care of myself as well, not resting enough, not, doing the things, eating well. And so I think that for that, it's kind of, a case by case basis.
That's good. That's very good.
Mhm.
So when if we were to begin to look at something and begin to summarize what's really important in talking about that in terms of lifestyle management,
Mhm.
medication, pharmacy, if we looked at a whole body wellness program, if you could wave a magic wand and create something the way that you would want to create it as a pharmacist, how would you create a program, a wellness program that would help people before medication, during medication, and after they finish the medication to understand it, to practice it, to use it?
I would focus on preventative health, you know, um,
Mm-hmm.
going and getting, whether it's free checkups, we offer like free blood pressure checks here. We do cholesterol checks. Um, the moment you kind of notice something, come and speak. If you can't get into your doctor's office, come and talk to the pharmacist, because they may be able to kind of lead you to where, what you need to do next. And so, if I could wave a magic wand and have my way, I would, um, people would be more, um, I guess, attuned with their body and understanding what it needs, and coming to, your professional, not when something happens, but just regularly, preventative, um, and kind of identifying those things before it gets out of hand. So wellness checks are extremely important. And just kind of reaching out to, your healthcare professionals, whether it's the local community pharmacist or, your provider if you have one, because some people just don't have a provider. So feel free to go to the pharmacist. They have a wealth of knowledge. They're in the center of the community. They can, if they, based on what you tell us, if there's something that we feel like you need to go to the doctor for, we can lead you there. And so I think that that's what I would do, have people more engaged and more active with their own health, because um you kind of can't help people that don't want to be helped.
That's right. That's right. That's right. That's true. That's true.
So kind of being more active with yourself and engaging with your providers for your own health. Hmm.
Oh, this is so helpful. I when I get off, I want to call you and get all your information. I really want you to be an integral part in the community. I mean, in us do that. Can you tell us about where you're located? Can you tell us about your practice? Can
Sure.
you talk a little bit more about that, please?
We're located in Stafford, Texas. Is right outside of like Missouri City, Sugar Land area. We service pretty much all of Houston. We have patients on the north side of Houston. We have patients on the south side, Missouri City. But we're located in Stafford, Texas, which is, right in the outskirts of the Houston area. We are a full service pharmacy. So we provide everything from compounding, retail medications, we do vaccines, we do health checks. So if you need your blood pressure checked, if you need a cholesterol check, we do that as well.
Mm-hmm.
We also are accredited medical equipment supplier. And
Mm-hmm.
so if you have Medicare, you can come to our pharmacy and typically get any of your medical supplies free of charge, if it's covered. But we are a full service pharmacy,
Mm-hmm.
and we have a family approach. We think of every single patient as a part of our family, and
Mm-hmm.
that's the feel that people get when they come here. So
Mm-hmm. Oh, this is great. Okay, I do want to thank you and my co-pastor Samuel Massey, who's had technical difficulty from Real Life Christian Church, and I do want to thank Dr. Gorell for being with us today. From in the name of um, apothecary,
the
uh,
apothecary pharmacy and medical
the
supply.
apothecary pharmacy, and medical services. I do want to thank her for taking time this morning to talk about it. She will be, and I'm getting ready to talk, she will be an integral part. You will see her in the future, I'm sure, in more places than she is now. And we're going to help spread that. We have just graduated mental health coaches who will work in the community and will work with her to help support persons who may be in need. And so we'll look forward to that. If you're interested, please go to www.wrc-houston.com. Sign up to be a mental health coach. Use your gifts and your talents, your skill. We're asking for physicians, nurses, pharmacists, everyone to just sign up, bring on one other person to be your outreach and work with you in the community. This is a way that we can change attitudes, help heal people, and provide services. So please go on, and you'll be shocked at the cost. It's only $150, not $2,400, and you'll become an internationally certified mental health coach. And you'll be able to help people. You'll know about everything, some of everything. So please go on and take this step. Not let's talk about it. Let's put a foot and feet to the word. Okay, then, and I'll look forward to seeing everyone. I do want you to remember this: renew beliefs, rebuild faith, and reconnect families and communities. For it is not the circumstances we meet, it is the manner in which we respond that determines health, happiness, and success. And we will look forward to seeing you same time, same place, same station. And if you're interested, go to our website or email IPS, like I like India, P like Paul, S like Sam, dot health, one, HEALTH, one at gmail.com. Express your interest. Say that I want to know more about it and join our Saturday Wellness Clinic. And you'll be able to come on. There's no charge. You find out information, you know where to go for what. Okay. See you next week. Thank you.